Hello, I'm Dr. Richard Becker. It's my pleasure to welcome you to the University of Cincinnati College of Medicine's Scholar Vision. Today we'll be discussing an emerging topic of importance, that is cardiovascular oncology. I'm joined today by Dr. John Lynn Jefferies from Cincinnati Children's Hospital Medical Center and its Heart Institute. Dr. Jefferies, I'd like to talk a little bit about the unique aspects of the children's program and also things that we can do together as a part of an integrated program.
So as you and I have had extensive discussions about this, I think this is a unique opportunity for the city, for the region, and for our two historic centers. We have all of these patients that are surviving into adulthood from our pediatric cohort, and obviously this robust population treated at UC, all of which by definition are potentially at risk for cardiovascular involvement. I think to have a high-level cardio-oncology program really is not just about treating patients, which I think both institutions do very well and leverage the tremendous resources that exist at both. And we've had very effective collaborations managing patients, both from children's coming to UC and UC coming to children's. But it's more so about how can we prevent this disease, how can we understand the mechanisms. And I think that the basic science and the translational science that exist here at UC as well as at Cincinnati Children's afford us a very prime opportunity to understand the processes behind cardio-oncology, the pathology, the pathophysiology, and potentially be targeting therapies. As you know, in heart failure and coronary disease and other diseases, we're trying to be more mindful of a tailored approach to treatment. And I think that's really what's needed in cardio-oncology, not only as a preventive strategy, but as these patients progress and mature, how are we actively treating and anticipating needs of the cohort in the future. And I think that that's something that we are extremely well positioned to do.
Yes, I agree with you. And it's kind of been an interesting journey when you look back into the 1970s and the original reports with the anthracyclines. I think we've come to understand some of the myocardial toxicities, but what we're seeing a fair amount of now are some of the subtleties where blood pressure has changed. And our patient population traditionally is one with a very high incidence of hypertension. So we're looking at ways to, of course, give them the benefit of these newer therapies, but being mindful of changes in their therapies to make sure their blood pressure is not out of control.
Well, and I think that that's why a dedicated approach is important. If you have someone managing the myocardium, someone managing the vasculature, someone managing the malignancy, without crosstalk, that patient will not do as well as they could. Yeah. And so understanding these ventricular arterial coupling mechanisms and other things is a unique opportunity. And it really gives you targets that aren't currently taken advantage of in the current milieu. Yeah. So I think that it's a robust research opportunity. Mm-hmm. And the findings of that may impact the general population. But I think cardio-oncology is such a unique group of patients that will inform us that really is somewhat underserved in the current area, in the current era of cardiovascular research investigation. Yes. I think that's something that we need to really pay attention to.
You've made a couple of very, very important points. First of all, having a research platform, ways to study so that we can anticipate what the potential effects might be. And then as we follow individuals, what is the ideal means of tracking and identifying, preventing, and then treating if need be.
Yes,
so,
sir.
Thanks so much for joining us on Scholar Vision today.
Thanks for having me. It's a pleasure.
It's our pleasure to have you. I'd like to thank Dr. John Lynn Jefferies for joining us today on this episode of Scholar Vision. We've talked a lot about the emerging area of cardiovascular oncology, what some of the causes might be, including chemotherapy, radiation therapy, or their combination, how we can identify some of the potential effects on the heart and the vasculature, how we can treat some of those effects, and very importantly, research platforms that allow us to better understand who may be at future risk. Until next time, please keep asking questions. Inquiry is the true compass of scientific and scholarly advance.